The important thing, though, is that people need to know what their weight situation is. And the one thing that we all go by in the United States and the Western world is something called the body mass index, or BMI. That's a big number. You can calculate that by yourself, but that's really difficult. It's much easier to look that up. And one way to look that up is everybody has a smartphone. You can actually go on our website or just punch in your internet thing on your phone, rwmc.org, then hit a space, and then BMI, and you will directly go to our body mass index calculator, and you can find out what your body mass index is. Okay, because the body mass index will tell you if you're overweight or if you're obese or morbidly obese, which category you fall in. And that determines if you qualify for surgery. Who qualifies for surgery? In our program, you have to be 18 years or older. We do not treat adolescents, okay, 18 years or older. There is no upper limit. So I've done the gastric bypass on someone who's 76. Because if I can give that 76-year-old 10 more healthy years running around, that's well worth it. That's great quality of life. So there's no upper limit for that. The next important thing is the body mass index. So if someone has no medical problems that are connected to weight, to obesity, so if someone has no diabetes, no high blood pressure, no heart disease, and no sleep apnea, those are the 4 big ones. If you have none of those 4, your body mass index needs to be 40 or higher. Okay? None of these 4 conditions, 40 or higher. If you do have just one of those conditions, one or all of them, doesn't matter, but at least one of these conditions, then your body mass index needs to be 35 or higher. Okay, so one condition, 35 or higher, or one or more conditions, 35 or higher, 40 with no conditions. Okay. People should have tried to lose weight before. So this is really, although it's the greatest thing, although it's pretty much the only thing that works in the long term, you still should have tried to lose other ways before. Like gone to the dietitian, talk to your doctor, go to any of those programs and before you come to us. If you don't, we're usually going to ask you to see our dietitians for a few months, usually about 6 months, and then we can do the surgery if you're not successful. Okay. Most insurances pay for the surgery. Occasionally they don't. There is an option to pay out of pocket. You can talk to our office manager and then talk about the pricing and everything.